Washing my hands. Hello there. My name is Jamie. I'll be your nurse today. How you feeling?
I'm doing okay.
Good. Well, I'm coming in because I want to do an assessment of your head, your eyes, your throat, and your nose and your mouth. So I just want to let you know that that's what we're going to be doing today.
Okay.
Could you go ahead and verify your first, last name, date of birth?
Erin White, 6/24/1993.
Do you know what day it is today?
Monday.
Do you know what month it is?
August.
And who's the president?
Biden.
Okay. Patient is alert and oriented ×4. So what I want to do is just ask if you're having any pain anywhere before we start.
No.
I want to check the range of motion in your head. So I'm going to have you look down for me. Good. Look all the way up as far as you can. Good. Bring your head back to midline. Turn to the right and to the left. Good. So you got full range of motion there. I just want to inspect, kind of make sure you don't have any skin issues, any hair loss or anything like that. Do you have any issues with hair loss? No. Skin looks intact. I just want to feel nice, warm, pink. All your hair is there. That's good. Your eyebrows there are good too. I want to just make sure that you don't have any swelling around your eyes because that could cause some irritation. So I just want to feel. Are you having any tenderness in here?
No.
No. How is your vision? Are you having any vision issues?
No.
No? Okay. So I want to assess your eyes first. So the first thing that I'm going to do is just to check your pupil accommodation to light and see how reactive they are. So I'm just going to have you look forward for me. Just a light here. Good. Good. So your pupils are 3 millimeters round and equally reactive to light. I'm going to do what's called a swing test, where I'm just going to bring the light from each eye to each eye, and I want to see how quick they constrict and then dilate. So I'm just, same thing, have you look forward for me. Good. Good constriction and good dilation on both sides, and they're very quick as well. I'm going to check your cranial nerve. And the cranial nerve, if you have any damage there, it'll tell me by the way that your eyes follow my finger. So I'm just going to have you look forward. Watch my finger. Good. Up, down. Good. So your cranial nerve is intact. Next thing I'm going to have you do is cover your right eye for me. Look straight forward. I'm going to test your peripheral field of view. So you tell me how many fingers I'm holding up. You look straight forward.
1, 2, 3, 4.
Good. Switch eyes. Same thing. Look forward for me.
1, 2, 3, 2.
Very good. So your peripheral field of view is good. Next thing I'm gonna do is just look at your ears. Do you have any pain in your ears? Anything mass noted? Anything in there?
No.
No issues of hearing or anything like that?
No.
No? Okay. So the first thing that I'm gonna do is just inspect. I'll bring out the light here for this. Alright, the skin is intact. There's no kind of like moles or crystals or anything in there. Your ear is clean. I'll look at this side now. Good, skin's intact, nice and warm. There's no moles or any kind of lesions, anything there. So I'm gonna have you turn your body totally around, and I'm just gonna inspect the different parts of your ear. So right here is your helix, and that looks good. This up right here on the inside is your antihelix, and that looks good. Right in here is your concha, that looks good. Lobial looks good, and your tragus is good as well. All right, you can turn back around and face forward for me. I'm gonna test your hearing just by doing a whisper test.
Okay.
So I'm gonna close one ear, whisper 2 words in your left ear, and then you tell me what I said.
Pretty day.
Good. We'll do the other side now. Couldn't hear anything on that one?
No.
No. Do you have any kind of hearing?
I do have hearing loss in my right ear.
Okay, alright. So I will note that. Do you have any kind of like balance issues from that you've noticed?
No.
And your gait's okay? Okay. Next thing I'm gonna do is just inspect your nose. So you just look forward for me, just some light here. Any problems breathing or anything?
No.
There's no deviation, no kind of blockages. Your nose looks clear there. We can do a smell test. So I'm just gonna have you close your eyes. I've got something here. You tell me what it is. I'm gonna hold it up to your nose here.
7.
Good. Alright, I'm gonna look into your mouth now. Are these all your teeth?
Yes.
Do you have any kind of like lesions or cuts in there or anything I should know about?
No.
Okay. Open up. Yeah, stick out your tongue for me. Good. Mucous membranes are pink, moist. There's no lesions. Open up, say ah.
Ah.
Good. The uvula contracts when you do that. Nice and midline there. Those are your teeth there too. Go like this. Clench down. Good. Everything's midline there. So the last thing that I'm going to do is just go over all the different nodes in your head. There's quite a few, so we'll just talk and go through them. Okay. The first two are the preauricular and the postauricular. So the preauricular sit right in front of your ear. I'm just going to inspect. You tell me if you feel any pain.
Okay.
I'm feeling for any kind of swelling or anything like that. Any pain or tenderness there?
No.
Good, no swelling. Postauricular right back here behind the ears. Any pain there?
No.
Good, no swelling there. The next I'm going to feel is your submandibular. It's just right above your jawline here. I'll feel it here. Any pain?
No.
Good, no swelling. Next one I'm going to assess right here is your submental. It's right underneath your chin. Any pain there?
No.
Good, no swelling there either. The next ones I'm going to assess are your occipital, which are like behind your ear and down slightly, kind of right on your neck here. Any pain there?
No.
Good, no swelling there. I'm going to assess your superficial cervical, which are right here. Any pain there? Good, no swelling. I'm going to assess your deep cervical chain. This chain kind of runs diagonal from your chin down to your shoulder. There's quite a couple spots here. Any pain there? Here? Here? Good, and no swelling there as well. I'll assess your thyroid gland. Do you have any thyroid issues?
No.
You can look straight forward for me. It's just kind of right here. Any pain there?
No.
No? How about here?
No.
Good. I'm going to assess your posterior cervical, which are back here. Any pain here?
No.
And then your supraclavicular, which are right here. Any pain there?
No.
Good. And no swelling as well, so you don't have any issues with your nodes or anything like that. And that's going to conclude the exam. Do you have any questions for me?
No.
All right, I'm going to step out and then I'll come back and we'll get started on our day.